When talking about the new COVID-19 variants, the first thing we must understand, according to internist and intensivist Dr. Jorge Hidalgo, is that it is normal for viruses to mutate.
It mutates since the day one. I mean that some mutations essentially are imperceptible. The virus continues life. Some others essentially end the virus life more quickly. But in some particular cases, like the UK variant, is that those mutations, as I show, it will have certain properties in the virus that will take advantage.
When those mutations start to change the behavior of the virus, there is cause for concern. In September 2020, the first variant was discovered in the UK. The following month, in October, another new variant was found in South Africa. And now there is confirmation of a Brazilian variant. These three variants are concerning because they're all more transmissible.
That more transmissible mean that as we remember, you remember, we usually have the spike, the characteristics of the virus. No, I mean that the spike protein, who is the most important one, that's essentially make more attached to the body. I mean that that's mean that is the way how we are getting is more easy. Is basically the ability to the virus to attach to the person and make the person sick more easy. No?
According to Dr. Hidalgo, there is added concern about the new Brazilian variant and its potential for causing reinfection.
This particular one is they are saying that there are certain problems with the antibodies, but I think so we will need to have more information with this particular one.
How does this impact or prevention efforts here in Belize? At this time, samples have been sent outside the country to test the country's strain. We do not have those results as yet.
But what we need to do immediately is trying to adhere to that we are preaching all the time: social distancing measures, and of course isolation and quarantine. In countries like us that unfortunately we don't have all the resources, it's best to prevent rather than in a few weeks we are trying to see an escalate of cases that is probably could be out of control. No? I was talking yesterday with one of my colleagues, an intensivist in Spain, and they are saying that the number of cases they are seeing is completely out of hand right now. And again, is the fact that more people are getting sick, but also unfortunate are the more vulnerable people. No? You know, right now is that it make more people sick. That means that there are more people in the hospital. The health system is in more stress. There are more people in the ICU. Mean that's the reason why we also seen increase on mortality.
Scientists say the best way to stop these and future variants is by slowing the virus's spread. For some countries, that is through vaccination, which so far prove effective against the new variants.
So far, the Pfizer vaccine and the Moderna vaccine, they already are trying and also shown some data that it proves effectivity with that. No,
Until Belize gets access to the vaccine, Hidalgo says we can stop transmission by wearing your mask, hand washing, social distancing, and avoiding crowds.